Today, I'm actually going to be showing you real data that indisputably proves that adrenal fatigue can be caused by autoimmune disease. Regina had these results this week. Okay. And I want to show you a typical result review. And I want to prove to you why, based on these results, adrenal fatigue can absolutely be an autoimmune disease. Okay, so that was a big debate in the Facebook group. The questions were going back and forth about that. People are like, no, it's not. The truth is, it absolutely can be. I'm going to go ahead and share my screen right now. Okay, and we're going to just look at a typical adrenal result, in fact, of Regina this week. Okay, and will you be my assistant?
I would be happy to.
I'm going to have you play typical. Regina is 55. She's currently in our program. She's postmenopausal. Okay. We do know she has fibromyalgia. We do know she has POTS. Okay. She comes in, never had her hormones tested before because she was told she didn't need to have it tested. Okay. She's got chronic fatigue. She's told she's 55. She's got fibro. Of course she's tired. Okay. In the meantime, she's got POTS where she is losing her job as a social worker because she can no longer drive.
Mm.
She's fainting because she can't when she walks she gets dizzy, she falls down. She her heart faces really fast. She's been in the ER just 5 times in the last year, and that's from repeated attempts. Every time her heart starts to go really fast and won't slow down, and her blood pressure starts to drop. And she was just recently, after 5-6 years of this, recently, in the last 6 months, diagnosed with POTS by the cardiologist, told that she needed to take some blood pressure medication to lower the pulse, but that made her blood pressure worse. Didn't help. She ended up in the ER multiple times because her heart rate was super fast and her blood pressure dropped. She got so dizzy, she doesn't even trust her driving anymore. And then on top of this, she's noticing more and more sensitivity to food, digestion problems, bloating, more and more foods she can't tolerate, allergy to supplements and medication, and even mold and environmental. Her allergies are going through the roof, and she's like, "What the hell is happening?" That
She
is
needs
the This is the typical person going through her program. So you're going to be Regina. How many of you are Reginas out there? Because I'm not
Yes.
making this up. This is based on at least 5 of the people I talked to this week that I went
Mhm.
over results on. Okay.
Yeah.
So Regina, let's take a
Yeah.
look at these results. So based on these results, and you've watched modules to learn this in the program, Regina. What
Yeah.
would you say? First of all, are you estrogen dominant? That's probably going into too much depth. Let's go
Right.
into let's
But,
go
but
in.
I think I would say yes.
You are, but
Mhm.
no doctor's gonna tell you that. But yeah, she's
Mhm.
actually estrogen dominant because she's actually watched me train on this. Number 2 is, what's the second pattern that you see?
And it's interesting too. Most people would say, "Well, how could you be estrogen dominant when look how low your estradiol is?" But yet you taught us how exactly to tell that. So
Because
yes,
estrogen dominance has nothing to do with whether your estrogen is high or
exactly.
low. It has to do with the relationship between estrogen and progesterone.
And
Okay?
progesterone. So
Okay?
yes, Dr.
And
Maggie, I, Regina, am
and
estrogen
wait,
dominant.
Regina. I'm not gonna go into this, but when the dots look like they're on the same place,
Mhm.
you might say she's not estrogen dominant. We actually in our program teach the tiebreaker. There's another number that you look at that can tell you indisputably, yeah, Regina is actually estrogen dominant.
Yeah.
So there are a lot of tricks here on how to do that. That's number one. But the main pattern, though, we do see here, looking at these are the ovarian hormones, the estrogen, progesterone, testosterone in the left upper corner. The adrenal hormones, this is the DHEA and cortisol. Based on this, what pattern is this, Regina?
I am a low everything pattern, Dr. Maggie.
What the heck? Your doctors don't believe that exists. It's not real.
It's clear as day. It is clear as day when you look at this result.
It's a pattern I call low everything. It doesn't that pattern doesn't exist outside. Doctors don't know that. But low everything is a very unique pattern in autoimmune disease. Okay, I'm going to tell you this because Regina is 55, but she has hormones of a 90-year-old right now.
Doesn't
And
feel good.
and and Regina, just this week, how many other people did you see with this pattern?
At least a half dozen.
So what happens is, let me give you guys the scientific principle behind this is if let's say you have Hashimoto's, you have an autoimmune disease or Graves of your thyroid, that means your body's already mistaking your thyroid hormone making cells as a germ. What's the likelihood of that person body also mistaking their ovaries, their adrenals, their brain hormone making organs, their pancreas making making insulin? What would be the likelihood their body's mistaking not just their thyroid, but all the other hormone making organs as a germ? What do you think is the percentage, Regina?
100%.
I teach us 100%. So here's my guess is Regina, I don't remember, and I don't know what Regina's hormones results were from this program, but Regina, did you have any problems with based on your thyroid labs?
I did. I had low thyroid and I have a history as well of other thyroid problems.
So let's talk about that because here's the thing is I can tell looking at this pattern, this person already likely has an autoimmune disease of their thyroid because they're low everything. But most of the time, the doctors don't understand thyroid either, don't know the right labs to do, and they don't even call it, they don't even test it. So Regina, prior to this program, you're telling me you were already diagnosed with low thyroid before. Am I correct?
Yes.
Okay. So here's the thing. A lot of people with low thyroid don't even know they have autoimmune disease of the thyroid.
Yeah, because
So
I tested negative on the, antibody results.
she tested negative. She's lucky she even got a test, but she tested negative on her thyroid. So she was told, you don't have autoimmune disease of the thyroid. Based on these results, I can already tell you the likelihood her thyroid is autoimmune is already close to like 90 to 100% because it's already attacking her ovaries and adrenals. So why wouldn't her low thyroid be an autoimmune attack of the thyroid?
Well, and that
Right?
makes sense because when you mentioned the ovaries, I have had trouble with my, female system as well.
Yeah. Did you have any fertility issues?
I had infertility, yes, so perhaps this autoimmune attack has been going on for quite a while.
And this is why people say that the most common reason for infertility is actually autoimmune because there's an actual autoimmune attack against the ovaries, right? But that's the other thing is the people who have infertility issues, a lot of them also have adrenal hormone problems and also thyroid. So if you look at people with Hashimoto's and Graves, there's a much higher chance that they have infertility issues because
Mm.
it's also attacking their ovaries and their adrenals. So what people don't realize is that ovaries and adrenals can 100% be a target of autoimmune attack. In fact, I see it all the time.
And you can tell all of that just by looking at this page.
I more, even more. Think about this. I mentioned that I think even extrapolating more, I think your thyroid is autoimmune. So I'm going to ask you something. Do you have
Mhm.
any history of thyroid goiter, nodules, or cysts, Regina?
Both goiter and a couple nodules.
Did you ever know that the number one cause of goiter and nodules is an autoimmune disease of your thyroid?
My endocrinologist never mentioned that.
Boom. So she's been walking around with not just low thyroid, but autoimmune disease of the thyroid, with walking around giant Goomba with the goiter and a nodule. And and people are saying, oh, your thyroid testing for autoimmune disease is negative. Therefore, you don't have autoimmune disease of the thyroid. That's crap. Because the reason it matters to me and the reason it matters to you, Regina, is why do we care it's autoimmune of your thyroid?
Well, as you taught us, that puts us at a 10 times greater risk for cancer.
Thyroid cancer. Okay. So, would you want to know if you were 10 times higher risk for breast cancer, for colon cancer? Of
Absolutely.
course
And
you
we
would.
still get the preventative screenings for that 100%.
Well, there's preventative screening for thyroid cancer too. It's called thyroid ultrasound. But the thing is, if you had no idea that you had autoimmune disease of the thyroid, number one, and number two, that puts you already at 10 times higher the risk. Why the heck would you even ask for a thyroid ultrasound? But here's the other thing too is that these autoimmune disease against your hormone making organs can be really difficult to diagnose. So somebody's going to be coming back to the thyroid. They're going to be like, well, Regina tested negative for thyroid antibodies. So of course she doesn't have autoimmune disease of the thyroid. So I'm
Hmm.
going to ask you, what do I teach you in the program that says that just because you have those two tests negative doesn't mean you don't have autoimmune disease of the thyroid?
Not accurate because there are over 6,000 targets of attack on the thyroid, and yet there are only three commercially available tests to determine the antibodies for it.
Yeah. And if you even go to specialty laboratories, overall, we have maybe about 11 tests out of the 6,000 targets. We only have 11 targets that can be tested. And in a regular lab, three. So Regina and everybody else in the program who happened to get those couple tests, if they did to see if it's autoimmune, then can get erroneously told, oh, those two tests are negative. You don't have autoimmune disease of the thyroid. But what they really should be saying is two out of the 6,000 tests show that you don't have autoimmune disease of the thyroid. We don't know what's happening with the other 5,998.
And yet there are things that you can do, and I know this isn't supposed to even be about thyroid, but there are so many things you can do then to prevent the growth of cancer and to continue to watch to ensure that your thyroid never gets to that point where you
Well, that's
fall
the
victim.
whole point. There's an intervention, and that's what we teach in this program. You're powerful. You have an intervention. And that's why the program is Transform Autoimmune is really, to me, really important is number one, I care it's autoimmune. and I know it's autoimmune. And number three, I can prove it. And then number four, you can intervene in it to break the cycle so it doesn't turn into thyroid cancer. It also doesn't get worse. And you're never going to get another autoimmune disease. How about that? Because when you deal with stopping, pulling back the autoimmune attack, it's not just the target you think you have, it's the other thousand target you don't even know you have that's going to get less and less and less of the autoimmune attack, which goes back to all these other hormones.
When you start to realize it's all connected, that's when the lights really start going off above your head because
Mhm.
you have all of these symptoms and you've always been told that they're all separate things that need addressing or don't even need addressing. And yet you're able to tie it all together and then help us address all of it.
Absolutely. And so I'm going to just action item, massive action. Look, success leaves clues. Successful people take massive action. So I'm going to tell you, when are you going to actually break the cycle of this in yourself? Right. And so a couple things. Number one is that we have my hormone masterclass. If you want to get a start on just hormones, my hormone masterclass is there, and which is focused on ovarian and adrenal hormones. And if that's where you want to start, that's great. We're going to have a link there for you to message our team and say, I want my hormone masterclass special. But the most important thing you can do is book a call with our team. So we'll put a link for you to schedule a call with our team to talk about it. And you can learn what that offer is.
You mentioned the 5 pillars, and it is the 5 pillars that's the true solution here. Once you implement
Yeah.
everything in the program, that can help stop the craziness of what's happening with your adrenals.
Mhm,
It can help correct things that are happening with your hormones.
mhm.
All of the chips fall into place
Yeah.
once you achieve the 5 pillars.